Hey, you guys, welcome back for another week of topics and tips. And as promised, this week we are covering osteoporosis and osteopenia. A lot of review students I find are familiar with what this is, but struggle with quickly being able to identify one versus the other because they're so common, right? So this week I want to get into these two topics, talk about common treatment options and things to look for in education you should provide to your patients. Okay. But as always, I like to give you guys a disclaimer with all of my videos. So you guys that have been following me for a little bit and have taken any of my courses or know my videos, welcome, 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 you guys. And welcome to those who are new to me. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. But my disclaimer, as always, to you guys is that these videos are used to educate you guys and to help you to prepare for boards and practice, and should not be utilized as an end all be all or treatment option solely, because you know that we take care of people on a patient by patient basis. All right. So let's get into this material. All right. So, what is osteoporosis and osteopenia? So, they're both conditions where the bones have become weakened due to your bones. What really happens in our body is that our bones work to make new bone tissue while getting rid of the old bone tissue. So it's continuously working in a process where those tissues, the old tissues, are being reabsorbed and new are being created, right? But the problem where we have this osteopenia and osteoporosis is that the bone I should say the remake, but the recreation of the new bone, it can't keep up with the old bone that's being removed. So when we can't keep up with our normal process of creating that new bone tissue, the structure is no longer solid as it should be, right? So what happens is those bones become much weaker, okay? So that is the problem, and that's where this condition forms. Um there's a lot of things and risk factors that contribute to that, and I haven't included here, but I want to just break this down a little bit more before I get into all of that. Okay, so let's just talk about one versus the other really quickly. So with osteopenia, that is what I call like the early stages of it. You know, almost like that pre-hypertension, pre-diabetes, so to speak. So a lot of times these patients don't even have symptoms; they're asymptomatic, don't even know anything that's going on, but may have had an exam or a test, or they meet that bracket where they're in the higher risk population, that female population, over the age of 35, things of that nature, that we start to do assessments for that population to determine if they may have these things, so we can stay on top of that because they do have the risk factors. We can't help genetics and the aging process, but you want to stay on top of it and watch. So commonly, that's where that osteopenia is noted, because they simply have an abnormal bone density test result. Okay. Whereas osteoporosis, same, they have an abnormal bone density test result, but it's much more severe. They're much more fragile and much more susceptible to having fractures. Okay. And so, going back where I was talking about the risk factors with osteoporosis and osteopenia, things that kind of put them more at risk again is that female population, that age group being 35 years of age and older, having low diets of calcium and vitamin D, smoking, excessive alcohol use. All of these play a part in those risk factors for osteoporosis and osteopenia. A sedentary life, is really encouraged to exercise, doing those weight bearing activities, menopause, hormonal changes, different thyroid disease, all of that can contribute as risk factors for osteoporosis and osteopenia. And then your patients, once we start to see this, because again, with osteopenia, it's really those early stages, so they may not have any symptoms at all. This may just be something noted or found on exam, because they do present with those risk factors. But those who typically reach into that osteoporosis diagnosis, they start to have a little bit more symptoms. Some people complain of that lower back pain. You may be able to visibly see changes in height, slight changes, or a curvature in the spine due to those bone structures not being formed and as strong as they should. So they're easily they're fragile, as I said. But all of these are things that go into play when you're identifying this and working with that patient population. So let's discuss how to diagnose this now that you have I've kind of given you that baseline, that foundation of what it is, understanding again that osteopenia is like those early stages, but there is some abnormality, and osteoporosis is where it's more severe. But how do we determine one versus the other, right? So when you have these patients, I mentioned those risk factors, and it's time to start scanning those because, again, with osteopenia, your patients may be asymptomatic. So if they are meeting this criteria where they're 35 years of age and older, they're female, they may have smoked, etc., you want to start evaluating them for these with these density scans. And a DEXA scan is the very most common scan, DEXA, DEXA, known. It's the acronym for the dual energy X-ray absorptiometry scan. And it's a short exam, non-invasive. It's a simple scan, takes you anywhere from about 15 to 30 minutes. And it's utilized to really look in and see and evaluate the bone density based off of how that calcium and everything is grouped together. Through the x-ray scan, but it gives you that standard deviation and a result of a t-score. And this is where people get hung up, okay? Because I can get my students to understand that osteopenia is an early stage and osteoporosis, but when you're looking at test on boards and they're giving you this t-score, a lot of people are like, wait a minute, what are we talking about? Wait a minute, which one falls under which? Okay, so knowing that it's the early stage is osteopenia, right? A T score of -1 to -2.5 is considered osteopenia. Now, a T score of -2.5 and lower is considered a diagnosis of osteoporosis. And this is one of those things, if you struggle with it, you need to make you some flashcards, write that thing down, study it, review it, make it one of those repetitive things that you are reviewing so that you're able to identify it. So if they give you a score and it falls in either of these ranges, you will know how to determine if it's osteopenia versus osteoporosis. All right. Easy enough, right? So let's talk about treating once we determine what they're in. Now, with the osteopenia, we want to do our foundational things. And with everything that we talk about, we start out with those lifestyle changes. So no different here, right? So osteopenia being that early stage of changes with the bone loss and the bone density being abnormal, and it can just be very slight. They may be asymptomatic, but if we're gauging this and they have the risk factors, these are the things you want to start incorporating with their lifestyle. So stop smoking, educate them on that tobacco cessation, reducing alcohol intake, doing those weight bearing exercises. We're trying to strengthen these bones and remaining active, paying attention to those vitamins and minerals, making sure that you're eating a balanced diet. You can also use vitamin supplements if need be, but being aware of those little lifestyle changes that can have tremendous benefit to your health. Now, if we have been diagnosed with osteoporosis, remembering that osteoporosis is where we have a more severity, you're more susceptible to those fractures, we may have to start pulling out medications for treatment. You still can do these lifestyle modifications, but as we progress in anything and it's more severe, we have to start doing a little bit more, right? So one of the most common medications that we treat with is that bisphosphonate class. And I need to get a really deep into that really quickly, but let me just say the additional meds that can commonly be utilized. You may need hormone replacement, vitamin C, calcium, etc. There's all other additional treatment options on board. But again, the most common one that you see once we reach into that osteoporosis medication range are the drug class, is that drug class of the bisphosphonates, right? And As we've been on our farm kick lately, let me just group this and go into those bisphosphonates. These most common ones, I want you to be able to quickly identify them, know what they are, know when we use them to treat. If we need to know what the contraindications or things to look out for, I like to throw those in. So here with bisphosphonates being that most common treatment option for our osteoporosis diagnosed patients, um, first understanding they end in the word dronate. So like Fosamax is a common one. Aldrogenate is the other medication name, but dronate is how it ends. Dronate. When you see that ending, know this is a bisphosphonate, right? And the bisphosphonates work by protecting those bones from getting weaker because it blocks those osteoclasts, because osteoclasts work by dissolving those cells in the bone. So bisphosphonates works by blocking the osteoclast from being able to even dissolve or break that down. And so that's helping protect the bones from the breakdown and allowing them to strengthen. Now that's great, but bisphosphonates does has risk. They do have risk factors. And you've probably heard it. I'm sure you have. And I like to really get into it so you can visualize and understand why we do the things that we do. But with bisphosphonates, this is the medication you tell your patients, take this on an empty stomach. So we kind of take it. You can't lie flat for 30 minutes, and you need to drink a full glass of water behind the medication. So commonly they'll tell you, hey, let your patients know, take it first thing in the morning. Hey, go for a walk. We're trying to do these weight bearing exercises. Go do some exercise for 30 minutes because that'll keep them occupied so they're not lying flat. But I like to tell you to also explain it in the fashion so in case they change up their day-to-day routine, that they know what things they should and should not do when taking this medicine. So make sure you're instructing them first. Hey, take this medicine on an empty stomach. Do not lie flat for 30 minutes after taking this medicine. And you want to make sure that you are washing this down with an 8-ounce cup of water. Why? If these patients have heartburn or anything after, any stomach upset, make sure you tell them to let you know because you want to evaluate this. But bisphosphonates can cause esophageal erosion, and it has a lot of other factors that it can contribute to. That is one of the major things that we are looking to try to prevent. So that's why you want them to be upright. That's why you want it on an empty stomach. That's why you want to flush with that 8 ounces of water so they can get it washed down so that we can get the benefit of the medication, but not cause additional issues. Okay. And so after explaining to them to take on an empty stomach, do not lie flat for 30 minutes, and to drink a full glass of water, then you can say, and hey, when doing this to help you with this, so as a reminder, get up first thing in the morning, do your 30-minute workout after you take it, and drink your water afterwards so that it helps them to do those things. But make sure you're giving them that foundational knowledge so they don't miss a step because it could be detrimental. All right, you guys. So that is the nitty gritty for osteoporosis and osteopenia. Um, I'll just do a quick recap as of everything that we covered. I know it was short and sweet, but I did give you a lot at the same time. So remembering osteoporosis and osteopenia are conditions where the bones are weakened, right? Um, Osteopenia is that earlier stage, whereas osteoporosis is more severe, and this can lead to more fractures in the body, right? We do those DEXA scans, monitoring those T scores anywhere from -1 to -2.5 is osteopenia. Anything from -2.5 and lower is considered osteoporosis. There are various treatment options. We can do those lifestyle modifications, reminding them, hey, stop the smoking, reduce the alcohol intake, eat a balanced diet, making sure you're getting your vitamins and minerals. If we need to supplement, you can with those vitamins and minerals. And if we have that diagnosis of osteoporosis that warrants treatment, bisphosphonates are the most common class of drugs for that treatment, ending in dronate, Dronate. and reminding them, hey, take that on an empty stomach first thing in the morning. Do not lie flat for 30 minutes and drink a full glass of water behind it. Also, weight bearing exercises are great for this to help prevent, but also in the management of it. And that's my spiel on osteoporosis and osteopenia. You know that tomorrow I will be doing practice questions to kind of test your knowledge on it. So hopefully, as you review this and you take notes and you review it in your own pace, that you'll be able to apply it and be successful on the practice questions. But as always, thank you, thank you, thank you for watching. And if you found this helpful, be sure to like, comment, and subscribe, and to share with any friends, colleagues, or anyone who you may think may find this beneficial. But you make sure you meet me back here tomorrow for some practice questions for Work It Out Wednesday. All right, bye, y'all.